When researchers meaningfully engage older adults, that is, provide a safe and supportive space for people with lived experiences to share their expertise, listen, and adapt, interventions may be more relevant and effective, and knowledge products may be more meaningful and have greater reach. We would like to introduce you to our partners. Why is it important for people with lived experience to join research teams and share their expertise?
I think it's really important because, especially with stroke, no two strokes are the same. But every stroke patient shares some things. Everyone shares anxiety and fear of the unknown. And I think that to be involved in programs like this gives you that voice and puts your voice in conversation with the people that are crafting the programs for your recovery. And while the recovery won't be the same for everyone, they need to know the kinds of things that are causing the patient anxiety, and that's entering into a system that they don't understand. And I think that anything we can do to alleviate those concerns or to lessen those concerns is extremely important.
I've seen the difference a patient can make to the project because they can take it and make it from being okay to being super. And that's generally what happens. And so I really push for having patients involved in it.
Why did you join the Transition Stroke Intervention Research Team?
Well, first of all, it was great to work with them. People cared about it, and we felt it was important to exchange information, and we felt that they did a great job with it. We had a lot of input on the MAPS system, the journey that we've all gone through, this journey with strokes, and it was great to have ways of learning new things. The research people were asking questions, and we had different ways of doing things and feeling it was like. With me particularly was aphasia, so I learned more about things about aphasia, and when the researching people were doing the great questions, it made us think about it, but it made them ask the right questions too. So I thought it was excellent. It was a great opportunity.
Well, when I was asked to join, I thought, well, maybe I'll learn something more about my condition and what's happened to me, and so I did join on that basis, but it wasn't long before I realized that these people were listening, these researchers were listening to us, and what we had to say was important to them. And so on that basis, I was really glad that I had been asked, and have enjoyed the process immensely all through.
I wanted to join the research team because I wanted to, as they say, make my mess my message, or your story your strength, and I wanted to be able to pay it forward.
What impact do you think the patient partners made to the project?
I think the contribution of the patient partners was really essential to the success. Not that I'm downplaying the knowledge and the experience and the learning of the researchers and the clinicians and the techs that are all involved in this, but I'm just saying that we bring a unique perspective as patient partners to this research program.
Researchers aren't looking at it from a patient's point of view, and the patient's point of view is the end result. And so they can tell you how to get there so much faster. And if they adapt to that, and that was what was really great with the McMaster study, was they listened to us and made that study, from down here up to the top.
I think this project was a real success because the patient partners were really listened to, and our feedback was really heard, and it was implemented. It wasn't like they weren't doing us a favor. Our feedback was really implemented, and I think that if the hospitals want to provide patient-centered care, it requires patient-centered research. And only people with lived experiences can really truly share what it's like.